Understanding pelvic imbalance, causes, consequences, and corrective measures. In this video, we will explore the complex dynamics of pelvic imbalance, how it affects posture and movement, and practical strategies to address it. The illustrations provided highlight common patterns of muscular imbalances and skeletal misalignments associated with pelvic asymmetry. Let's break it down. What is pelvic imbalance? Pelvic imbalance occurs when the alignment of the pelvis deviates from its neutral position. This misalignment can manifest in several forms. High right pelvis, lateral tilt, one side of the pelvis is elevated. Often results in compensatory patterns in the spine, hips, and lower limbs. Rotated pelvis, anterior, forward, or posterior, backward, rotation of one pelvic side. Impacts gait, posture, and functional movement. Overall skeletal imbalance. Shoulder drops and uneven hip alignment lead to biomechanical inefficiencies. Knee and foot compensations, for example, pronation or eversion, further complicate movement patterns. Tight muscles, quadratus lumborum, QL, causes side bending and contributes to the elevation of one side of the pelvis. Psoas, pulls the pelvis into an anterior tilt, affecting spinal posture. Adductors, shortened inner thigh muscles restrict proper hip movement. Tensor fascia latae, TFL, can cause lateral hip tension and alter gait mechanics. Weak muscles, gluteus maximus and medius, ineffective hip stabilizers leading to poor pelvic control. Hamstrings, contribute to posterior pelvic instability. Abdominals, insufficient core support exacerbates lumbar lordosis or kyphosis. Postural consequences. 1. Spinal misalignment. A high pelvis side increases the curvature, scoliosis-like patterns, in the lumbar spine. This leads to chronic lower back pain and potential nerve impingements. 2. Hip and knee dysfunction. An imbalanced pelvis places abnormal stress on the hip joints, results in knee rotation, creating susceptibility to injuries like ACL tears or patellofemoral pain. 3. Foot compensations. The foot of the higher pelvis side may supinate, while the opposite foot pronates, altering overall stability. How to correct pelvic imbalance. 1. Assessment and awareness. Identify muscular imbalances using simple mobility and strength tests. Observe postural patterns such as leg length discrepancies or hip hikes. 2. Targeted muscle activation. Strengthen weak areas, glute bridges, clamshells, and lateral band walks to activate gluteal muscles. Dead bugs and planks to engage the core. Stretch tight areas. QL stretches, kneeling hip flexor stretches, and pigeon pose for the psoas and adductors. Foam rolling the TFL and IT band. Pelvic realignment exercises. Perform pelvic tilts and stability drills to bring the pelvis back into neutral. Incorporate dynamic movements like lunges with core engagement to integrate alignment into functional patterns. Postural habits. Avoid prolonged positions, for example, sitting with crossed legs, that exacerbate imbalances. Use ergonomic adjustments for workstations. Professional guidance. Seek assessment and treatment from a physiotherapist or osteopath for manual therapy or corrective exercises tailored to your needs.